More than half of House lawmakers are backing an additional boost to welfare funding in next year's state budget, along with a policy change that would extend benefits to all children in a family. I spoke about this and other aspects of the state budget with State Representative Vega of the 5th Hampden District.
I think overall it's a good budget. I think there's a number of things in there that are really great. And of course, there's many programs that aren't funded to the level that we'd like to see. But again, I mean, I think that, unless you have real deep issues with something in the budget, I mean, this is the operating budget for the entire Commonwealth for the year. And I felt very comfortable supporting it.
Yeah, and you spent about 4 days going through the budget, about 1,400 amendments, about $80 million was added overall, to your point. Anything that you felt really was grossly underfunded this time around?
Well, I think underfunded, I would go back to school funding. I would definitely say that the commitment that the state has made for charter school reimbursement is never fully filled. That's an issue. The circuit breaker fund, which is supposed to be 75% special needs reimbursement back to municipalities. Even in our current fiscal year, after we just did a supplemental budget, we got up to 72%. So again, we're not even fulfilling that original commitment. So it's issues like that definitely, I think get our municipalities and definitely our school committees upset, and also get us upset too. And I'd say the third one would be transportation. Again, transportation.
Mercer Regional Transit Authority and Pioneer Valley Transit Authority say they're going to need to reduce their routes as a result of lack of funding.
Yeah. And I think it's frustrating because so many of these departments, I guess, if you will, not so much organization, but the departments are really trying to get back to their funding at '08 levels. And then think about, well, that's 11 years ago now. Right, at least budget cycles. So, even if everything was just going up, we know everything costs a little bit more every year. So we're not even hitting our levels where we were in '08, never mind what the increases should be over the last 10 years. And so, yes, funding for the regional transit authorities, everything outside of the MBTA was looking for $88 million versus $80 million. They got 82.
When you look at overall budget, the majority of House members voted for it, but there were a few who voted against it, including in this region. Representative Nick Boldiga was among those. He was the only representative from this region who voted against it. He wasn't able to be here today, but gave me some of his thoughts. And one of his concerns with this budget was the fact that it didn't include mass health funding that Governor Baker and Lieutenant Governor Polito had included. And he said that would have saved $270 million that could have been used for something else. Why wasn't that measure approved?
Sure. So this has been a measure that they put forth twice, and we've twice defeated it in the legislature. And here's the reason why. We have our threshold being 130% poverty level versus 100%. So 130% poverty level will qualify you for mass health. I'm open to the discussion, but the issue is that if you go from 130 to 100%, you're going to lose 140,000 people off mass health. And the structure, the infrastructure and the insurance industry can't handle that. They have no comparable plans that will give them nearly the better coverage or anything comparable for the comparable price. So you're going to have 140,000 people basically without insurance because they're not going to be able to afford on the network.
So what about some sort of phase-in? You've got a 30% gap there.
That's exactly what that's. So again, not that I'm necessarily in favor of talking about mass health. We have lots of different topics to talk about, but talking about the enrollment in and of itself. I would be open to seeing, yes, what if you went to 125% or even 120% and see what the impacts were, see how the industry would absorb that, see what the health outcomes are, see if we're suddenly having more visits to the ER because people aren't seeing their personal care physicians. You can't just do that kind of huge cut and expect 140,000 people to fend for themselves and not have an impact. So you're right. I think there would be a way to maybe look at it. What if you did 5% or 10% reduction and see the impact?
So something else that Representative Boldiga was concerned about was that the budget did not fund police training to a level that he would have liked to see. And he said, quote, "The Democrats voted down an amendment to create a matching grant program for cities and towns to hire police officers or local school resource officers that would have made schools safer."
I think, well, we've done some good stuff on school resource officers in the criminal justice bill around making sure that they're properly trained, that there is some funding around that, and making sure that there's a MOU between the police departments and the school departments. So we addressed a lot of that concern actually in the criminal justice bill. I'd also add that a lot of us were supporting an amendment that would have put a $2 fee on car rentals that would have gone directly to police training, and that wasn't adopted. So Democrats, quote unquote, were definitely coming up with other ideas for additional funding. But again, this was a budget that both Democrats and Republicans didn't want to make a money bill, didn't want to increase taxes or fees. So that ends up limiting what we can do.
Something that did end up in the House version of the budget was something that's been in place since 1995. It's referred to commonly as the cap for kids. As I understand it, basically what it says is if you have children after you've already been on public assistance, you don't get money from the state that would help you, sort of make
additional child.
Right, with that additional child.
$100 a month.
$100 a month, right, per child, right, or per additional member.
Yep.
Why was that included in this budget?
That was included in this budget because I think that the time was past due. Most states back in the early 90s that put this in place have taken it out. I think there's less than 17 states now that have this in place still, or less than 9 states even at this point. So the time has come. We can talk about, transition reform, welfare reform, whatever you want to call it, but let's not do that on the backs of children. This is 8,700 children in this Commonwealth that aren't getting any additional funds because their family was enrolled in this program before they were born. And the reality is, the real life stories is that, $25 a week might not sound like a lot, but it means that extra backs of diapers so that the kid's not staying in a wet diaper till they have to be changed. It means being able to get them additional good food. It means all those things that, unfortunately, $25 makes a big difference.
I could hear critics, though, saying, isn't this meant to, and even on the website for the state, it says, quote, empower residents in the Commonwealth. And I could hear critics saying, by giving people additional money, that's not an incentive. That's not empowering them. That's not helping them to go out and get a better job and improve their life in that way.
So even if I agree with some of that statement, let's talk about what that means, getting the parents the additional training, the job training, the education that they need, and making sure that when they actually get a job, they don't get kicked off benefits right away. There's no incentive right now that if I could have an $11 an hour job right now, and if it goes up, I reduce my hours because I don't want to lose my child care voucher, which is worth $800 to $900 a month. There's no incentive there to work. So if you want to talk about welfare reform, let's talk about what we're doing on the back end and not to the kids. It's no children's fault, no kid's fault being born into poverty that they were born into that situation. So why would we not give that family and that child $100 a month so they could get food, clothing, and diapers? I agree that there are issues with the system, but taking it out on the children who, to no fault of their own, are born into this situation isn't the right way to go.
All right, we'll have to leave it there on that particular issue. Let's look at some other things in the budget. There was something interesting. I saw the supplemental infrastructure financing for transportation. It's something that the Senate has rejected a few times now. The House version of the budget, it does include it. Are you optimistic that the Senate is going to go ahead and approve it?
I think it's going to be interesting to see what we do. I mean, the other thing is that we put in additional money into transit, into regional transit, $2 million to make it a competitive grant. So we didn't even put it into the normal formula. So there is definitely back and forth between the House and Senate on how we want to fund transportation overall. And I think that, again, without figuring out a funding mechanism for it, whether it's an increase on, what we tried to do a couple years back, an increase on gas tax or cigarette tax, whatever it might be, we're not going to find common ground necessarily. I mean, even now the Senate passed a supplemental budget, one that we passed, I think, 2 weeks ago, and they have additional stuff in there as well that wasn't even on our radar. So that comes to conference. I think it's, trying to get first 160 members in the House to agree,